See, that sounded good. You gotta remember you have some Yankee leanings like I do. You know how to say
Exactly.
I'm going to pass around something. It's a script for the kind of devotional meditation we're going to be talking about today. Feel free to take one. We'll get to that in a little bit. Today we're going to be talking about the use of a specific kind of mindfulness meditation for treating generalized anxiety disorder. For me, this all started with a patient. Most of my research over the last 5 to 7 years has been the response of seeing a patient going, oh my, what do I do with that one? And then going into the literature and finding, wait, there's nothing on that? And then creating something on that. I'm just lucky that someone always leaves a little gap for me. As I think of things in my own world, I know a number of you as people who think big thoughts, lofty, scholarly things you come up with. I'm not that guy. Never been that guy. True to my farmer roots, I fix problems. I don't really understand how they were created. I don't really care how they go away as long as what I do will get them to go away. It's what I'm good at. I see people that are hurting, who are missing hope, and I use the science God's given us to help them along with those things. That's really where this research came from. A lady was sitting in my office, a 55-year-old Caucasian female, saying, I'm not crazy, I don't need to see you, can we get this done? I love that patient. I get a lot of those. See, she had gone to the hospital 2 weeks before. Chest pains, muscle tightness, shallow breath, boom, 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 boom. What did she think she had?
Heart attack.
Exactly what she thought she had. She goes to the ER, they check her plumbing is fine. No signs of any cardiac or vascular concerns whatsoever. They send her home with aspirin. If you don't know this already, if a doctor sends you home with aspirin from the ER, they do not believe you. That's what that's coded for. It's a placebo. They send her home with the aspirin, industrial strength, but aspirin nonetheless. A week later, she's back at the ER. Having the same symptoms, fix me. They do more tests. Organically, she's fine. So she talks to her internist, and her internist says, I think it's something psychological. And I'm not doing any treatment until you see a psychologist. And she ends up in my office. We do an assessment. She has what we call generalized anxiety disorder. This is a disorder where someone worries, they experience free-floating anxiety, but on steroids. They might worry about things you would worry about, but they worry about them better than you do. Once treated a 10-year-old with this from central Pennsylvania who worried about global warming in Peru. They just are better worriers than you are. Because they're better worriers than you are, they even worry about their level of work. People with GAD have this what we call free-floating anxiety. Causes migraines, can cause digestive problems, cause incredible pain, including the distress of their world falling apart. It's a very intense disorder. That's what this lady was experiencing. She picked me when she Googled psychologist Marshall, Texas. She didn't technically have another choice. One. She picked wrong. She ends up with me, and she picks me mainly because when she Googled me, she found that I integrate faith into my clinical work. She's a believer, attends one of the Baptist churches around here, wanted to involve that. So once she came to accepting the mind-body influence on each other, she said, well, if we're going to do this, I want you to do that faith stuff with me. The problem is, I really didn't know what we used faith-wise for GAD. I knew cognitive behavioral treatments, but I wasn't really aware of anything. So I went into the literature. I knew in my own life when I treat anxiety for patients that don't do faith-infused stuff, I use mindfulness techniques, meditation, relaxation. I said there must be some kind of protocol for this for folks who want to integrate faith into counseling. When I went to the literature, there wasn't. Shocked me. We hadn't done any clinical work with this. Lots of mindfulness meditation from other formats, both quote-unquote secular, Buddhist, otherwise, but nothing from a Christian format that had been tested. So I was real confident this would work. She agreed to sign a consent to do an experimental treatment, and away we went. 5 weeks later, when we did assessment of teaching her how to do mindfulness meditation from a Christian perspective, her generalized symptoms of anxiety were gone. All the testing showed no clinical levels of anxiety. No more heart palpitations, no more chest tightness, none of that. No more ER trips, expensive ER trips. Through my experience with this lady, decided to do a larger study, which is what we're going to talk about today. A single-site design study involving a number of other clinical patients, testing the protocol I'm going to talk to you about today in treating generalized anxiety. Might be worth talking about right before we jump into this a little bit about why this stuff is important. Part of it is it all revolves around me. I'm inherently self-serving. One of the best ways that I've learned about God in my world and about His nature is through studying the science of His creation as it relates to His Creator. I started at Messiah studying how father abandonment impacted our concept of God. I was a psychic religion researcher. As I got licensed and moved into clinical work, my work became more clinical in faith integration. That has worked out well for me in that not only do I get to learn about God that way, but I actually found out this stuff kind of helps. Who'd have thunk it? What we learned as we did research is that if I give you a treatment for depression, say a cognitive behavioral treatment, from a conventional nature, we don't talk about God at all. Clinically, you will get better, believe it or not. We give you as a Christian that faith-informed version of the same treatment. You'll get equally better, equally the same way. As far as getting rid of your clinical symptoms, the cognitive behavior secular approach, faith-infused approach, will have no differing impact on your clinical depression. But y'all know that the absence of illness is not the same as the presence of wellness. And what we know from research is that for folks who subscribe to a certain religious or spiritual persuasion, if we integrate that faith tradition into their treatment, while clinically we'll see no change comparing that to the quote-unquote secular form of treatment, wellness scores will go up more for the person receiving a faith-consistent intervention. They'll get better either way from the clinical sense, but they'll thrive more effectively when we respond in a way that matches their worldview, their understanding of their work, and can use a language that they can generalize well to their milieu. That's why we do this. We can be Jesus with his skin on. We can study these things well so that we can help people thrive. For the last 5 years, that's what I've been doing. Most recently on this mindfulness stuff. Right before that, I was looking at faith-integrated methods for trauma-focused CBT for child survivors of trauma. Back when y'all mistakenly hired me. Fools. I was working on Christian cognitive therapy for treating depression and Alzheimer's patients. We've added a lot of great tools just in a decade that we can help people thrive while treating their clinical symptomology. This is the latest run at it from me. If you're not familiar with what mindfulness meditation is, I thought it'd be worthwhile to talk about it a little bit. Basically, what mindfulness meditation is it's the ability to experience your here and now, the present moment you're in, fully and authentically. Get rid of the noise, get rid of the distraction, get rid of the cognitive narrative you've told yourself about who you are, where you're going, what your future is, and just experiencing the moment. And particularly being able to do that from a non-judgmental manner. You all know some people in your world who a certain life event happened to, or they had a certain life-altering circumstance, and it's paralyzed them. I have a buddy who, we were runners-up for the state championship in football in Pennsylvania. This would be in '95. When you see him, it's still 1995 for him. He has a little football shrine for the Susquehanna Blackhawks. He still has the videotapes his mom made of him. He doesn't ask about your kids. He wants to talk about the highlight reel. He was a third stringer. He didn't play. But he's abdicated the rest of his life for this moment. You all know people who've had losses or hurts where they miss out on the present moment because they're beholden to the past. The research shows that when we focus in on things outside the moment, it limits our flexibility to act. If you currently are thinking, oh, I stink, or my life's hopeless, you only have a certain range of emotional responses that logically make sense there. You know, it's kind of like, you know, frankly, right now being a Steelers fan. They stink. They're going to stink all year.
Amen.
And, you know, it's because of the refs. That's my story. Logically, if I get focused on that, it's going to be very depressing. So I start thinking about next year. Inevitably, they'll stink. Anyway, when we get caught in those narratives, we can't help but limit our flexibility. Frankly, even the things we try to avoid limit our flexibility. You all have things you've apprised that's not worthy of thinking about or bad. Oh, that's a bad thought. I can't go there. Well, from a parallel processing standpoint, the minute you say that and try to actively avoid it, your frontal lobe is thinking about it. I'll give you an example. You're all smart people, so we'll do an activity here. Just do what I tell you. Don't think about bananas. What are you thinking about? Anytime you try to consciously, psychically avoid something, you can't help but dedicate energy and attention to it. That's what's required in your frontal lobe to say, I am going to avoid this now. That limits your flexibility to act based on the moment, as opposed to all these meta-narratives and cognitive distributions and attributions you make. Mindfulness meditation is about teaching yourself to experience that moment for what it is, in a non-judgmental manner that allows you then to act irregardless of your circumstance based on values that you hold. I don't have to say I am depressed. I experience some depressive symptoms. But that doesn't mean I now have to act like I'm depressed. I could choose to be happy in this moment. I could choose to be flexible and experience contentment, or say, you know what, a little bit of sadness isn't bad. That's normal. I don't have to say, no, sadness bad. Horrible. Don't have to do that. Mindfulness meditation helps us work through that flexibility. From a faith standpoint, I practice mindfulness meditation every day. It's part of my faith tradition. It's part of my journey. And what I find for me it really helps is it allows me to shut off the noise for a little while. There's always chaos going on around me. And if you come by my office, you can see the chaos is all over the floor. I'm prone to chaos. I create it, and then I live in it. Dr. New often picks up my chaos. Sorry. I really am. The reality is, though, when I get into that mindfulness mode where I can be still, I can wait on God for that responsive aspect of prayer, that transactional action of it, I now can be liberated from whatever cognitive chains I've been wearing. And that allows me to be free to act in whatever way God has called me to. That's really the power of meditation for us, when we can utilize it for our own life, for our adaptive abilities, for our coping abilities. When we look at mindfulness meditation from the quote-unquote secular world, there's lots of research on it outside of the Christian narrative. Whether we go straight Buddhist or some kind of secularized version, I sometimes get kind of uncomfortable with the word pure secular. Anything the truth is God's truth. So to me it's equally sacred. Truth is truth. But for the narrative, we'll call it that. When we do research on those things, you can see all these benefits that come from mindfulness meditation. Lots of research on thousands of studies. The interesting thing when I treat this 50-some-year-old lady for her generalized anxiety disorder and go into the literature, Michael can attest to this because he helped me with a lit review on this. Not one truly clinical study on the use of Christian devotional meditation, a form of mindfulness meditation, for treating clinical concerns. Not one published study on this. I don't know if Michael was shocked by this, but I was. I mean, there's thousands of studies every year. You guys know, you publish them. Not one. Closest thing we could find was a study on pain management. Now, meditation from a Christian standpoint, lots of studies on it. Just none clinical. They'd find grad students, they'd find undergrad students. You know how this works. You find a convenient sample, and because you got to publish for tenure or whatever else, you do a study. They say, oh, that mindfulness meditation, that's good stuff. But not with a clinical population. There's nothing to tell us. Good news is the research that we're going to talk about is going to be the first. It's a version of this manuscript that this PowerPoint is inspired off. It's been accepted by the Journal of Psychology and Christianity. And so there will be some literature on this. The case study that I developed off the lady, I'm inherently an opportunist, was the first case study on the use of this form of treatment for generalized anxiety disorder. I've never been bright, but I'm smart to know the right time and right place, and I tend to be in it. And that was the case in this case. I was fortunate that lady entered my life. The Lord was ever provident for my own faith journey for that, but also for the purpose of creating this knowledge.
Jay, I was thought like fishing for it.
It is, particularly my fishing. I have no skill whatsoever. But I do end up like where I live now, where there's lots of fish and no fishermen. Bob can attest to that. It's a lot like fishing. Good observation. When we think of mindfulness meditation from a faith-informed perspective, there's technically three kinds of it that have been studied with non-clinical samples. The first one is what I utilized with my patient and in the study that we're going into. The second two, they are highly involved processes. You need a lot of training, and they take months to get good at them. I typically don't have months with patients. I work from a cognitive behavioral standpoint where I'm never going to become your best friend. We get you in, we treat you, we get you out. That's the world I work in. Sometimes managed care does that for me, but inevitably I can't trust that we have years anymore. And so the last two I didn't study. We went with what we call centering prayers or Christian devotional meditation. You have a script in front of you. I'll just basically tell you how we do it. This is something that we utilize in this clinical study that I did, but this is something, frankly, you can do in your own life. I do this in my life. I utilize for the purpose of the study the God's Character version, which there's two forms of centering prayers. Sometimes people in their centering prayers focus on a Bible verse, or they focus on a phrase of God's character, such as God is good, God is love. And basically what you do, I'll just do it from the chair here, I teach clients to get into a good relaxation stance. Basically, you want an open posture of some sort. If you like the lotus flower thing, for some reason, biologically, that's actually a very relaxing pose for most people. But many of us can't go lotus wherever we are. And if I tell my good Baptist clients to go lotus, well, bad things are going to happen. So in most cases, just an open posture, feet flat on the ground. The feet flat on the ground part actually matters. If you put your feet up, it will cause muscle constriction. You won't relax as well. Feet flat, and you start a good deep breathing process. In through the nose, out through the mouth. Have to be deep breaths. You have to breathe from your belly. God designed us so amazingly. When you breathe from your diaphragm as opposed to your chest, is a biological cue to your brain that says the parasympathetic nervous system is supposed to kick on. It's kind of like your thermostat in the house. You get to a certain temperature, time for the air. Well, when you breathe from your diaphragm, your parasympathetic nervous system